Okay, sweet. All right, well, welcome everybody. Today is the 15th of April, and I am here with Anna Cruz from Fresno County Department of Public Health. So welcome, Anna. Give us kind of our latest COVID update.
Awesome. Thank you, Andrew, and good morning, everybody. So I'm going to go ahead and start today with some of our numbers as of yesterday at 4 o'clock in the afternoon. So total cases to date for our county is 100,357. So we did see an increase of 543 from the last week. And then, as you can see on the, if you're watching, on the left-hand side, we did have a bit of a higher increase last week. So it looks like our cases are coming down a little bit. So the total number of tests received and processed to date, 1,130,075. So this was also an increase of more than 24,000 in 1 week. And that increase is also a smaller increase from last week. The total number of deaths to date in our county, 1,636. We did see an increase in the past week of 39 deaths. In this number. So it just goes to show we're still seeing a lot of negative things come out of this pandemic. And the number that we currently have hospitalized, 101, and this number did decrease by 18 in the past week. Thank you. All right, and so the updates we've gotten from the state, we are currently still in the red tier this week. This means that sectors may be open or closed or can open with modifications. So our positivity rate that was reported is at 3.5. Case rate was reported at 5.9. Our unadjusted case rate was 5.6. So we did get a little dinged for not having our testing as close to or equal to the state median. And our health equity metric is at 4.2. So you can see we have all of our metrics in the orange tier. So this means if we do have orange metrics the next week, the earliest we could be in the orange tier would be next Wednesday, April 21st. So, and I want to also highlight that on case rate, it's at 5.9. So that's, we barely just made it there in the orange tier. So hopefully we can either, keep the same or go down a little bit for next week so that we can go into that orange tier. And as always, please help us to promote and reinforce the 5 W's, wear a mask, wash your hands, watch your distance, be wary of crowds, and when it's your turn, please get vaccinated.
Which is now.
Which is now, yeah, everybody's turn. And a few health department updates. So the Fresno County vaccine schedule did get updated last week on April the 8th. That was when the county announced that everybody 16 and older is now eligible to receive a vaccine. There are lots of registration opportunities, which I'll talk about in a moment. We also did send out on Tuesday an alert to medical providers about the Johnson & Johnson vaccine, which I'll talk about also in a few moments. And we also wanted to give you an update that the county proclamation that was set last year for an emergency order was actually repealed by our County Board of Supervisors. And it was repealed due to the current phase of the pandemic, but this will not impact local agencies who are currently involved in coordination with COVID-19 vaccination response. Perfect. And testing. So please do not forget there are still very many free testing opportunities in our county. And please continue to promote these free testing opportunities. 2 upcoming testing events. One of them is today, April 15th from 5 to 7:30 p.m. Clinica Sierra Vista, the West Shaw location. Walk-ups are also welcome. So if you know anybody that's looking to get tested today, please send them that way. Also this Saturday, April 17th from 9 to 1 p.m., there is COVID-19 testing event in Del Rey at the Alex Fonseca Park. That event is from 9 a.m. to 1 p.m. and walk-ups are also welcome there. The other testing opportunities that we also have available in the county that we promote every week are the Optum testing, locations. These are located in Sanger, Coalinga, Reedley College, Fresno City College, West Fresno Regional Center, and Mosqueda Center. So please, please promote those locations for us. Thank you. All right, and a few vaccine updates. So currently we are in distribution phase 1C, and this means that all residents 16 and over in our county are now eligible to receive a COVID-19 vaccine. For those who are age 16 and 17, they must register to receive the Pfizer vaccine. That's the only one available for those under the age of 18, 16, and 17. So to date in our county, 41.4% of residents 16 years and older have received at least one dose of the vaccine, and a total of 549,533 doses have been administered in our county as of Tuesday, and this includes county and non-county recipients. As you remember, our vaccine dashboard is currently tracking all doses that we administer, and that includes people who also do not live in our county. For residents 65 and older, 76.3 have received at least one dose of the vaccine. So we're doing pretty good on our 65 and plus population. So Johnson & Johnson, the FDA and the CDC did put a pause on this vaccine as of Tuesday, April 13th. So a health alert was sent to all county medical providers, giving them the information and asking them to please put this vaccine on pause for now. So 6 cases developed blood clots. These cases are under investigation to determine if the J&J vaccine was a contributing factor. So if you've received a vaccine recently, the J&J, Dr. Vora did say you should be fine. If you develop any of the following symptoms for more than 48 hours, these include severe headaches, abdominal pain, leg pain, shortness of breath. And the key thing is here is that more than 48 hours, so persistent pain, you do want to contact your medical provider or visit your local clinic to get that checked out. But this is still a really rare occurrence. So if you've received the vaccine, there's no need to worry unless you have these persistent symptoms for more than 48 hours. Our local providers who were offering J&J are currently offering the Pfizer vaccine in place of J&J for this week. But we'll have more of an update for our next call. And then lastly, we still are seeing continued increases in cases across the country. So we need to remember, we need to open our local sectors cautiously and continue to follow our 5 Ws to prevent another surge in our county. All right, and here on this slide, we have all of our vaccine sites. We don't have any new ones this week. I do want to mention, though, that the Sunnyside Clinic registration is now available through MyTurn as well. So for the full list of vaccine opportunities, you do want to visit our COVID-19 webpage and then click on COVID-19 vaccine. It'll give you all these vaccine sites: Kerman, Selma Senior Center, Fresno City College, St. Agnes, Sierra Pacific Orthopedic Clinic, Sunnyside Clinic, the African American Coalition at Gaston Middle School, Sanger OptumServe site, the Fresno Fairgrounds, and Reedley College. And again, there's also vaccine testing opportunities or events, which I'll talk about on the next slide.
Anna, have you seen, are the sites impacted, or how with the new tier, with everybody being open now, how's registration going?
So registration is still, I mean, I don't think we have all our appointments booked up now that everybody is available. Joe did mention a few weeks ago that we have gotten to the first 500,000 doses, and the next 500,000 doses that we'll need in order to get to that goal that he talks about is going to be a little bit harder. So there's still lots of availability. Once we opened it up last week, we did see an increase, but there's still lots of appointments available. They're not completely full.
Okay, cool.
Okay, so 2 vaccine opportunities. The first one is actually today in Tranquility at Tranquility High School. You do have to register for this event. So if you have friends or family members who live in the area of Tranquility, please call to register to see if they still have vaccines available. That phone number is 559-450-7770. And then also today in the community of Mendota, at the Mendota United Health Centers Clinic, there is a vaccine event from 9 a.m. to 12 p.m. So it's currently ongoing. There are only 300 doses available for the event in Mendota. So if you currently live there or have friends and family members who are in the community of Mendota and they're looking for a vaccine, it is recommended that they call. And the number for the United Health Centers is 800-492-4227. Thank you. And lastly, our California Health Equity Vaccine Goals. We did share this with you last week. So just as a reminder, we have reached the 4 million doses that the state of California had a goal of reaching. And on the left-hand side, we did snip a little graph of where we're currently at. And as a reminder, the state wants us to reach these goals in our quartile 1. So this is the least healthy communities in our state. And so we've reached that goal. The next goal for the state is called Beyond the Blueprint. So here, the state of California plans to fully open its economy as long as we meet 2 criteria. So 1, there's equitable vaccine availability. So as long as we have a good vaccine supply, the state is looking to fully open the economy. And then number 2, we want to see a consistently low burden of disease. So this means low hospitalizations and that people are fully vaccinated. So once we are reaching those 2 metrics, then the state will look at opening the economy as of June 15th.
Say more, what does consistently low burden of disease mean? So is there a number for hospitalizations or?
That's a good question. I would have to probably read a little bit more about that. But I know our hospitalizations are low across the state, especially the other number that we have kept really low is our positivity rate across the state. I'm thinking that the state wants to look at the hospitalizations and positivity rate statewide. I know that county to county, it can vary, but I think at this point the state is now looking statewide. So.
Okay, cool.
All right, and lastly, like we do every week, we have our resource links page. So all the links you saw throughout the presentation are available on the last slide for easy access.
Fantastic. Well, thank you, Anna. We look forward to next week. Next week, we're going to be diving into, we're actually going to have Dave Palmerville on, both to give us a little more context around some of the vaccines, some of the latest news, and then also to celebrate his kind of tenure in public health and just kind of get some reflections from him and his time. So look forward to that call. That'll be the 22nd at 9 o'clock, and we'll see you there.
Awesome. Thank you. And thank you all. Please remember to promote the vaccine and get vaccinated if you haven't received your vaccine yet.
Awesome. Thank you, Anna.
Thank you.
Stop.